Thank you so much, George. And it's a pleasure to be with you. Thanks to the organizers for putting on this terrific discussion. And I certainly enjoyed Dr. Assam's remarks. I'm going to talk about the use of artificial intelligence in weathering the COVID storm. And as a preamble, I'm going to argue that we did some things with artificial intelligence in this pandemic, but there's much more that we could do, as Dr. Assam suggested. So overall, there was a great variation among countries in terms of how they responded. And it's increasingly clear that how countries respond affects the clinical consequences, affects how many people are harmed, how many people died. Some countries, like Iran, initially tried to deny that anything was going on, and things went poorly there initially. Other countries like South Korea and Taiwan, for example, leveraged electronic tools to deal with the consequences and used contact tracing very effectively. I'm going to suggest that most of the COVID-19 forecasting models have used traditional epidemiological approaches, and that's worked well, but I think it's likely that we could do better in the future with AI. Machine learning has been used for things like outbreak detection, timely diagnosis, to predict death rates and rates of other complications. And finally, I'm going to make the point that there were major issues with data flow in this pandemic. And if we want to do better in the future, we have to do much better with data flow, and that would enable us to leverage AI in real time, which is where we want to get to. Dr. Sam mentioned Blue Dot, but I'm also going to talk about this. And they detected COVID-19 well before the World Health Organization. And their secret sauce was that they collect lots of information which are outside of official healthcare sources, like how the more than 4 billion travelers are moving on commercial flights annually. They collect data on human and animal and insect populations. They collect climate data, use local information from journalists and healthcare workers. And they look through nearly 100,000 online articles daily in 65 languages. So they're really looking at many different things. And that's a key thing about AI. Often you use data sources that are non-traditional. So what do you do if you need to control a novel infectious agent with unknown behavior, such as we were dealing with in this instance? You need large quantities of data in near real time. And public health data in particular suffers typically from old infrastructure and lags in data collection and privacy concerns. In the US, many reports were being faxed in to public health centers. And this is something that we really need to work on going forward. In addition, in most developed countries, electronic health records are not routinely used as data sources by public health agencies. But in the future that we've heard about, they should be being used for better surveillance. There's all kinds of health information in there, which is very helpful. And finally, you need not just case counts and death rates, which is what we've had typically, but rich information about who gets the agent, who's at greater risk for it, and what the short and long-term consequences of acquiring it are, so that you can make intelligent decisions. We've argued that COVID-19 has really 4 important curves, and those of you who listened to Dr. Amalberti heard another version of this. We think most about the infectious disease curve, and that's the problems that the disease itself creates. But the issues of chronic disease and ignoring chronic disease are also really important. It's been shown in the US, for example, that the number of people who were turning up with heart attacks went down by over half during this pandemic. And we don't think that those people were not having heart attacks. We think that they were just staying at home and having them. And that is undoubtedly very risky. So this carries really very substantial risk to the population. There are also big issues with mental illness, things like depression and anxiety and social isolation. That's a very big issue as well. And finally, there are major inequities that have been exposed by COVID-19, things like unemployment and health disparities and social determinants. There are a number of constraints to use of AI, and you heard about some of these. Typically, the data are incomplete, and that can lead to uncertain or biased estimates. So for one example, the CDC reported that there were approximately 10 infections by their estimation for each reported case, and only the worst cases were being counted early on. It's also true that major disparities exist in the populations affected by COVID-19, and yet some of those inequalities are probably even underestimated because of the lack of racial, ethnic, and socioeconomic variables in our data sets. So we need to do better at gathering those. And then finally, sharing of data is difficult if agreements aren't already in place. And we did reasonably well with moving data around in this pandemic, but this was definitely a challenge. So how could we do better in terms of sharing data going forward? It's clearly critical to have better approaches, and there are a number of examples that were quite successful. One is the COVID-19 Decision Support Dashboard from the COVID-19 Healthcare Coalition. That includes over 900 healthcare organizations which agreed to share information about COVID-19. The second example, which is radiological, comes from the Radiological Society of North America, and they set up a COVID-19 data imaging repository so that you could look at large numbers of images and draw important insights from that. IBM set up something called their functional genomics platform, which enabled people to look at the genomics of this pandemic. And finally, the European Imaging COVID-19 AI initiative was supported by the European Society of Medical Imaging Informatics, and that's also been a useful resource. There's some other examples. One example of using artificial intelligence in real time comes from this organization called Clue, which basically set up tools to monitor patients who are in the ICU. And then using AI, warn providers of patients who were at risk. Here, there's one patient who's in the red zone. There's another patient who's in the green zone, and who could probably safely leave the intensive care unit. And tools like this, I think, will be very effective going forward in managing patients more effectively. And people have talked about how rapidly things were set up. This is a Sheba hospital in Israel, in which Clue, over a 2-week period, set up tools to monitor all the patients in this COVID unit, which was very rapidly set up. And the patients in this unit had very good outcomes, probably in part because of the AI that they were being monitored with. Another thing that's happened is we've developed a number of ways to visualize data, and it's critical to just have data at our fingertips and to visualize things better. This is from Worldometer, which probably many of you have looked at. It just looks at the cumulative number of cases of COVID by country, by number of days. And this was from August 4th. But we're all now used to looking at visualizations like this. They've been extremely valuable in making choices. So what about future pandemics? Well, I agree that it's essentially certain that future pandemics will occur. After all, we're a global society now. We move around. There are 3 critical steps, and those are prepare, respond, and recover. And I would suggest we actually have done reasonably well overall with the response part of things, and where we need to do better going forward are around the preparation and the recovery, which are in many ways harder. When nothing is going on, it's been hard for countries to invest in making sure that they're prepared. And in the U.S., we eliminated a number of the entities that were doing some of the best work in helping us be prepared just before this particular pandemic. Countries need to prepare and then maintain high quality public health data sets which can be shared. That is critical for policymakers to make decisions. You need also frameworks for sharing data between various entities like governments, health systems, industry, and academics. You need not just infectious disease data, but a wide array of data, as I discussed previously, and that has to address things like health equity and mental health and the chronic disease consequences. And then finally, you have to balance resource allocation between preparation and management and recovery. And here, too, I would suggest that we've really focused far too much on management and not enough really on preparation and recovery. So at the end of the day, I would suggest that keys to performing better in pandemics of the future will be able to predict what will happen. And also what the impact is of specific actions. There's so many actions that policymakers can take, things like closing borders or sending ventilators to specific areas. What about getting the population to wear masks? Or the one that we're dealing with now, what happens if you send children back to school? You need 4 things to really manage well. You need robust data. You need public health infrastructure. Collaborative networks are pivotal. And then you need appropriate policies, and the policies should be science and evidence-based. At the end of the day, I think artificial intelligence played an important role in this pandemic, but it will play a much more important role going forward. So I thought that polling question was a really good one. It will be a key enabler of better management in the next pandemics. And I will stop there, and I want to thank the audience and again the organizers.